I'm Professor Graeme Yorston, and today I'm going to be talking about 5 of the strangest mental health conditions that I've encountered over my 30-year career as a psychiatrist. Fregoli syndrome is where a person believes that someone is out to get them, and they can change their appearance and take over the bodies of other people.
A person with Fregoli syndrome believes that a persecutor whose identity is well known to them undergoes repeated changes of appearance to take over the bodies of other people. Often they are scared that the disguised imposter is out to harm them, and even though the impostors show no physical resemblance to the person they are being persecuted by, they are convinced they are one and the same. It was first described by 2 French psychiatrists in 1927. They named it after Leopoldo Fregoli, an Italian music hall performer who was one of the world's most famous entertainers at the time. In his one-man shows, he was known for being able to transform himself instantly and almost miraculously into multiple characters with different costumes, voices and physical shapes. Their patient was a young woman who believed that she was being pursued and tormented by 2 famous actresses, Robin and Sarah Bernhardt, who were able to take the form of people she knew or met, or take over her thoughts, make or prevent her from doing things, stroke her, and force her to masturbate. She believed that their actions were destroying her body, but somehow creating an attractive dark line around the actress's eyes. Misidentification delusions often leave people in fear of their lives, and they may act aggressively to protect themselves. In one case, a man with schizophrenia killed a stranger in a coffee shop as he was convinced he had seen him and his wife having sex in a pornographic film. He acknowledged that neither his wife nor the man looked like the people in the film, but he believed that they were able to change their appearance and that his wife could even change her vagina and skin colour. The Fregoli delusion often occurs with other types of delusional misidentification syndrome in schizophrenia, severe depression, dementia, or traumatic brain injury. Why people develop these delusions is not yet fully understood, but patients often have abnormal brain scans, and a 2-hit hypothesis has been proposed, in which a deficit in facial recognition or processing occurs alongside an abnormality of reasoning, and allows incorrect interpretations of visual images to persist. Most people with this problem are not dangerous, and most respond to medication.
Koro is the strange belief that your penis is shrinking and being drawn back inside your body.
Koro is an example of a culture-bound psychological condition, which was first described in China and Southeast Asia in rural, undereducated populations with strong beliefs in the supernatural. It occurs as individual cases and in small-scale epidemics, and it causes immense distress and anxiety to men who become terrified that they are going to die because something is pulling their penis upwards and into their bodies. Occasional cases of men developing Koro-like beliefs have also been reported in Africa, Europe and North America, but these tend to occur in people with clear signs of other mental disorders. The term has also been extended to women who develop distressing fears that their nipples are being drawn inwards or their labia are shrinking. Typically, people experience Koro as acute anxiety, which can last for several hours, with sweating, shortness of breath, tremors, chest pain, and even diarrhea. Most cases affecting people from an ethnic Chinese background are associated with a sense of abdominal pull, that something is drawing the penis inwards, and that if it disappears inside, they will die. This can lead to frantic efforts to make sure that this doesn't happen, by pulling on it, tying string around it, or tying weights onto it. The panic it induces can be so intense that attempts at suicide are not unknown. In the 1990s, an epidemic of anxiety about genital shrinking was reported in West Africa. There, however, affected individuals interpreted the experience as someone stealing their penises and spiritual essence, and this was bound up with traditional spirit beliefs or juju. In Benin, 5 people were burned and hacked to death when mobs attacked individuals accused of penis theft. It is very rare in the West and less common in China than it used to be as education and social conditions have improved, but it remains an everyday problem in remote areas of Indonesia. There are many theories to explain it. One is that Koro arises from traditional cultural beliefs that during normal vaginal sex a healthy exchange of yang and yin humours takes place, but with masturbation and nocturnal emissions this cannot occur, and the unbalanced loss of yang humour produces Koro. In one epidemic, all of those affected had heard of the syndrome and seen media coverage of the outbreak, suggesting that it is an example of mass psychogenic disorder or mass hysteria. When assessing a patient, it is important to explore the nature and origin of the beliefs and to check they don't have a physical condition affecting their penis. It is also important to make sure patients are not just talking about the perfectly normal phenomenon of the cold water shrivel. Most of the time, explanation and reassurance is all that is needed, but if it is part of another mental health condition, then treatment is directed at this. In Indonesia, traditional healers called dukuns treat Koro by giving vigorous massages, driving energy towards the shrunken penis. Ekbom syndrome is a delusional disorder characterised by the unshakable belief that you are infected or infested with some kind of parasite, worms, insects, bacteria, even mice. They can be on your skin, in your skin, or even eating away at your internal organs. It is named after Carl Axel Ekbom, a Swedish neurologist who first described it in 1937. Symptoms often begin with itching or a sensation of something crawling or burrowing into the skin. These may be real physical sensations that are interpreted in a delusional way, or they can be abnormal perceptions or tactile hallucinations. Patients can often identify a precise onset, with symptoms starting after an insect bite, foreign travel, sharing clothes, or contact with someone they believe to be infected. This can lead to them focusing on minor skin blemishes or sensations they were previously able to ignore, and then misattributing their symptoms to a parasitic cause. They may damage their skin attempting to dig out bugs or by using strong chemicals to disinfect themselves. Patients are usually very reluctant to accept that they have a mental health condition and consult general practitioners and dermatologists, often taking the evidence of their supposed infestations along with them, usually bits of fluff or skin debris. It is quite rare as a primary disorder, but more common as a symptom of another disorder such as severe depression, schizophrenia, dementia, or Parkinson's disease. It also occurs in people with cocaine addiction who experience a sensation of ants crawling on their skin called formication. It usually responds well to medication, but because many patients reject a psychiatric diagnosis and refuse to take medication, the disorder can go on for many years and dominate people's lives.
Exploding head syndrome has just about the strangest name in the whole of medicine, but it doesn't take the number one spot because it's a relatively common and benign sleep disorder that most people don't even know they have.
Up to 20% of young people experience exploding head syndrome at least once in their lives. Just as they are falling asleep, they hear a loud or frightening noise. A thunderclap, gunshot, or bomb going off. It is usually very brief and not painful, but understandably it can make people jump out of their skin. Some people also see flashes of light or lightning or get tingling feelings. People may wake up feeling confused or distressed, and they may have myoclonic jerks and a racing heart. Some people also have the sensation that they have stopped breathing and they have to make a deliberate effort to breathe again. Some people have this once or twice only. Other people have them in clusters over a few weeks or months, but most people have them on an occasional basis for their whole lives. At their worst, they can occur several times per night. They can be brought on by stress, jet lag, or other interruptions to the sleep cycle, and are more common in people who have other sleep disorders, especially sleep paralysis. Its dramatic name was coined by British neurologist John Pearce in 1989, but the history of the condition is much older, with French psychiatrist René Descartes being the first known case in the 17th century. His biographer describes how he had a new dream in which he believed he heard a sharp and shattering noise, which he took for a clap of thunder. The fright it gave him woke him directly, and after opening his eyes he perceived many sparkling lights scattered around the room. In 1876, Silas Weir Mitchell, an American neurologist, reported a patient who had a nocturnal sensation of a pistol shot, which he called a sensory shock, but it was then largely forgotten. Because EHS has only recently come to medical attention, there has so far been very little research on it and the cause remains unknown. Fortunately, for most people, a simple explanation of what is happening is reassuring and no further treatment is needed.
This is it, my number one weirdest mental health disorder, Diogenes syndrome. A condition in which people withdraw from the world, neglect themselves and live in extreme squalor, often with a total lack of concern at how they are living.
It is meant to be quite rare, but I seem to have seen more than my fair share of cases over my 30-year career, squeezing through tight passages, clambering over clutter and stepping over animal waste to get into their houses to see them, all the time holding my nose because of the smell. They accumulate mountains of rubbish, either by compulsive hoarding or by just not throwing anything away. Their kitchens can become unusable by having stacks of dirty plates build up, many with half-eaten meals on them left to rot. Cupboards have food that is years out of date, and fridges can be full of unrecognisable things that seem to have evolved into new life forms. In many cases, people simply accumulate junk which piles up in a haphazard manner in their homes, such that they may not be able to use their own bedrooms and take to sleeping in an armchair in the lounge. Other people, however, have a lifelong pattern of collecting things and cling on to some kind of methodical order in the chaos. They neglect their personal hygiene and physical health. They may not wash for months or years, and they won't go anywhere near a doctor. Skin ulcers, appallingly bad teeth, scabies and body lice are common. They refuse all offers of help from family, friends and neighbours, and often become totally isolated. I've seen cases where people have had their utilities cut off, and even a house where someone just defecated onto newspapers and threw them into a corner of the room. The accumulation of waste can lead to infestation by rats and other vermin, and this may finally force them into contact with public health services and result in a compulsory admission to hospital. It is named after ancient Greek philosopher Diogenes of Sinope, but although Diogenes rejected the materialism of Athens by dressing in rags and living in poverty in a large barrel, he certainly did not hoard, and he was not socially withdrawn, going out into the agora or commercial heart of the city on a daily basis with a light, saying he was looking for an honest man to highlight the hypocrisy of Athenian society. But despite not really fitting, Diogenes' name seems to have stuck. As is the case for many syndromes in psychiatry, Diogenes syndrome is not a diagnosis in itself, but a description of a cluster of behaviours that can occur in several different mental health disorders. It was originally described in older people in the era before brain scanning was available, and while some cases had obvious signs of dementia, others did not. However, later research has shown that some of those with none of the classic signs of Alzheimer's disease actually have the subtler and harder to diagnose features of frontal lobe dementia. Diogenes syndrome can also occur in younger people with schizophrenia, depression, and obsessive-compulsive disorder. It has been postulated that some people who develop Diogenes syndrome in late life have a long history of a subclinical personality disorder with a tendency to be unfriendly, obstinate, aloof, aggressive, independent, detached, stubborn, secretive, suspicious, quarrelsome and eccentric. The change from this into the full syndrome may be precipitated by a stressful life event, such as bereavement or retirement, often aggravated by debilitating physical health problems. In my experience, some of the people with rigid, quarrelsome and stubborn personality traits also have signs of an autistic spectrum disorder that may never have been picked up. Some studies have found that many patients are undereducated and have lived in poverty most of their lives. However, others have found equal numbers of patients with solid family backgrounds and successful professional lives. The early case reports emphasised the dangers of removing people from their homes and admitting them to hospital with poor responses to treatment and high mortality rates. But leaving people in their squalor doesn't end well either. There is no easy answer other than trying to build trust and chip away at their stubbornness.
That's it, 5 of the strangest mental health disorders in clinical practice. My intention in making this video was to increase awareness of these disorders and also to reduce stigmatisation of mental illness. They may seem odd or even funny, but I've seen people with all of these conditions in my work as a psychiatrist and none of them found it funny. The human mind is a fascinating thing, especially when it goes wrong. And it has been my privilege to try and help people with mental illness for over 30 years. If you'd like to know more about any of the conditions I have described today, then please click onto my channel where there are films dealing with each of the conditions separately, alongside videos on how our understanding of mental health has evolved over the course of human history. Thank you for watching. Don't forget to click and subscribe if you want to be kept up to date with all the latest videos. See you again soon.